We'll reminisce about the memories and all the friendships that keep you coming again and again and again. Daydreaming, grilled delights, and culinary delicacies. We'll reminisce until then. We know there are no white sand beaches in your city, so we'll reminisce until then. The world took a time out because we all need a time out. We'll reminisce until then. We're in this together as one with another until we see you again. We miss you just as much as you miss Anguilla. We'll reminisce until then.
Yeah.
About how
Good morning,
the cool
everybody.
winds blow
We're about to begin.
and the
Thanks
sun
for being
always shows up. We'll reminisce until then. Songbirds
Justin?
sing sweet, sweet melodies that ring over and over again. We'll
Justin?
reminisce about the memories and all the friendships that keep you coming again and again and again. Daydreaming, grilled delights, and culinary delicacies. We'll reminisce until then. We know there are no white sand beaches in your...
Thank you for tuning in this morning as we present the soft opening accommodation sector protocols for Anguilla. I'd like to begin by recognizing the ministers of government who are present. We have the Premier, Dr. Ellis Lorenzo Webster, Minister for Infrastructure and Tourism, Minister Hayden Hughes. We also have Minister of Education and Social Development, Ms. Deanne Kentish-Rogers, Minister of Economic Development, Mr. Kyle Hodge. We also have Minister of Home Affairs, Mr. Kenneth Hodge, and the Speaker of the House, Ms. Barbara Webster-Bourne. Thank you for being here and all of the invited guests and media. Before we begin, we'd like to begin with a word of prayer, and I'm inviting Pastor James Harrigan to open us up.
Good morning. Let's go ahead, please. Our Father in heaven, we are grateful to you for this morning, the 18th day of August, 2020, that you have spared our lives to see this beautiful, splendid day. We are happy to know, dear God, that we can call you our Father, and we are privileged to be loved by you. We thank you, Lord, for the fact that we have been spared the onslaught of this disease, COVID-19, and unlike other countries, Father, we are standing well. We ask you today that you may help us to continue in this status. Help us, Lord, that the decisions that we make today will be made in the best interest of our people of Anguilla, for our livelihoods and our economic well-beings. Grant us your favor, Lord, as we go through this session of discussion and information this morning. In Jesus' name we ask. Amen and amen.
Thank you, Mr. Harrigan. We'll now begin with introductory remarks from Premier Webster.
Adopting the protocol already established, I'd like to acknowledge the presence of the Chief Medical Officer, Dr. Aisha Andrewen, Permanent Secretary, the Ministry of Health, Mr. Foster Rogers, Chairman of the Anguilla Tourist Board, Ken Roy Herbert. Good morning again. It's a pleasure to have you here. In keeping with my promise to keep you informed on latest developments within our government, I address you today on the COVID-19 situation and recent decisions approved in Executive Council towards the phased reopening of our borders. The World Health Organization reports that there are over 20 million confirmed cases of COVID-19 globally and about 1 million deaths. The regions of the Americas accounts for roughly 54% of these cases and roughly 53% of the deaths worldwide. Some Caribbean countries are now experiencing clusters and or evidence of community transmission, such as the Bahamas, Belize, Turks and Caicos Islands, Jamaica, Trinidad, and St. Martin. It therefore means that Anguilla must be responsible going forward as we try to manage both the health and the economy of the island. In this regard, a balance must be found which ensures that there is a measured and phased resumption of economic activity while protecting the gains Anguilla has made protecting the health of its residents by blocking the spread of the virus. For this, I'd like to thank the Chief Medical Officer, the Ministry of Health, and our hardworking public health team. First, I must report there are no active or suspected cases of COVID-19 in Anguilla at this time. Thus far, 269 persons have been repatriated to Anguilla. There are currently 50 persons in quarantine, whether at home or government-mandated facilities. This level of repatriation without any imported cases of COVID-19 in the country is impressive and a reflection of the strict protocols on repatriation and the highly responsible way in which residents of Anguilla have conducted themselves during the pandemic. However, as we continue repatriation efforts and begin the opening of the economy, the country will continue to have strict protocols to combat the reintroduction of COVID-19 disease in Anguilla. Repatriation of Anguillan residents has been the first step in the reopening of our borders. However, in July, repatriation from certain countries was suspended due to a dramatic increase in the prevalence of COVID-19 and heightened risk of disease importation from these countries. However, there is increasing concern as those abroad are encountering hardship as their resources are depleted, stress levels have elevated, and disease prevalence has increased in these countries. It is the goal of this administration to allow normal residents of Anguilla to come home and to get here during the next few weeks under safe and practical measures. With regard to the economic health of Anguilla, the reopening of our borders must be conducted in a controlled manner to ensure that the healthcare system is not overwhelmed or the Anguillan community put at undue risk. Thus, our approach until at least October 31st will be to follow a phased opening of Anguilla to leisure travelers and long-stay guests, with first preference provided to persons from areas of low COVID-19 prevalence. Working closely with the Ministry of Health, the Health Authority of Anguilla, the Governor's Office, the Chief Medical Officer, the following has been approved to allow persons to enter Anguilla. 1. Persons wishing to repatriate to Anguilla must obtain pre-arrival approval under the current repatriation program, submit a negative PCR test result between 3 and 5 days prior to arrival, mandatory quarantine in a government facility for a minimum of 10 days if returning from a location of low COVID-19 prevalence, or for a minimum of 14 days if returning from an area of high COVID-19 prevalence. PCR test on arrival, at the end of the quarantine period, prior to discharge, or before if symptoms develop. Number 2, the entry of leisure travelers and long-term stay visitors from locations with a low prevalence rate of COVID-19 will start under the following specific arrangements. Pre-arrival approval. A negative PCR test result 3 to 5 days prior to arrival. Mandatory restricted activity in a villa for a minimum of 10 days. PCR test on arrival and on day 10 or before if symptoms develop. Monitoring and surveillance and mandatory reporting by villa operators. Number 3, visitors and villa owners arriving from high prevalence areas are being considered on a case-by-case basis. This will be done following specific arrangements. Pre-arrival approval. A negative PCR test conducted 3 to 5 days prior to arrival. Mandatory quarantine of 14 days at a government-approved location or government-run facility if the quarantine authority believes this is appropriate. Mandatory COVID-19 testing on arrival, at the end of the quarantine period prior to discharge, or at any stage during quarantine if symptoms develop. Monitoring and surveillance and mandatory reporting by villa operators is essential. I want to remind persons that these protocols exist to safeguard the Anguillan public. Therefore, we seek your cooperation in ensuring adherence to the rules and regulations governing the entry of persons to Anguilla, including the need for pre-arrival approval and testing. Thank you.
Thank you very much, Premier. Protocol having been established, and to avoid repeating what the Premier has already stated, I just want to say that what we are embarking upon is unprecedented. There's no other country that are enforcing and ensuring these protocols. If you look at our competition, you realize that most of them are not having any testing whatsoever. Just this past Monday, Jamaica implemented a PCR test before arrival for 4 countries. And in St. Martin, you do a PCR test before you arrive in St. Martin, and that's it. So in Anguilla, while we are opening the economy, and we are at the same time protecting the health and safety of our people. So the protocol has been already stated by Dr. Webster, and we will have the opportunity for all of us to speak on that and to field all your questions. And I just want to thank the capable Parliamentary Secretary, the Honorable Quincy Gomes-Marie, who has been working every single day with the team, Dr. Aisha Andrewen, I hope I pronounced your name right, Dr. Foster Rogers, Ms. Banks, and the team there at the Ministry of Tourism. Also, not only them, but members of the Anguilla Hotel and Tourism Association, the president of the Anguilla Hotel and Tourism Association, Mr. Kevin Carty, the chairman of the Anguilla Tourist Board, and indeed the Anguilla Tourist Board. This has been a collaborative effort, not only by the principals here in Anguilla, but also Public Health UK, consultation with CARFA and the Pan American Health Organization. So there has been a tremendous effort going behind what we are doing here. And while it is that we may not all have the expertise, we all have the ability to reach out to those who have the expertise so that they can guide us and help us shape the policy that we are embarking upon. And I honestly believe that this will be a model for other countries to embark upon, because one of the things that we will do, and we will do at even though we're trying to open the economy, is to ensure that the health and safety of the people of Anguilla is of paramount importance. And while I say that, it's also important that we repatriate every Anguillian that wants to come to Anguilla. That is something that we will do, and that is something that we are already embarking upon. And there are Anguillians who will be coming to our shows again today. And so we are trying to ensure the health and safety of all of the people of Anguilla while creating opportunities for us to embark on. So without any further delay, I'll pass the mic over to my esteemed colleague, Ms. Quincy Gomes-Marie.
A pleasant good morning again to the media, those present, and viewing and listening audience. We are here this morning to present and discuss the protocols and intentions behind our soft tourism reopening. The difference between this and a general reopening of the borders is that the freer movement associated with open borders does not apply here. In this phased approach, like the repatriation process, persons wishing to travel to Anguilla must first apply. Any and all of our efforts taken during this peculiar time is governed and rooted in 3 main principles: research, risk mitigation, and capacity. The management of risk is at the center of this strategy. Therefore, prioritization of persons originated from low-risk countries is the first step in our strategy. The second line of strategy will be to limit the onward transmission of the virus from imported cases through sequential testing and the limitation of contact through highly controlled isolation, which will hereon be referred to as a stay in place. Persons from countries that are considered high risk will be reviewed on a case-by-case basis. That is, if they are a business guest, that is a person with a current or intended investment in Anguilla, their length of stay, and the prevalence rate in their individual locale. Now, many of you might have heard my team affectionately refer to me as the czar or the glue of this process. What this means is that I was appointed by the Executive Council to chair the task force responsible for bringing all the movement parts together, with my co-chair being the Deputy Governor, Mr. Perrin Bradley. This is an enormous task. It required consulting and working with the AG Chambers, ASPA, Departments of Labor, Immigration, and Customs to prepare the public service for the new normal. Primarily, it requires constant communication with the Ministry of Health, who guides our every step, the Ministry of Tourism, who is represented by Ms. Gina Brooks, who is responsible for creating the reopening protocols and staying abreast with industry practices and developments. The Anguilla Tourism Board, who had the task of adjusting our marketing efforts to suit this fluid and dynamic situation. And Thoughtful Digital Agency, whose responsibility it was to bring our vision of an online visitor application portal to life. The ATB, along with their partners, created the tagline for this campaign: find yourself, lose the crowd. Sorry, lose the crowd, find yourself. Right behind me. Our marketing efforts will be primarily geared towards digital nomads and persons with the ability to work from home, but we are still looking forward to our usual shorter-term guests. The reality is, getting to Anguilla will not be as easy as it used to be, but I can guarantee you it will be worth it, as it always is. If you love Anguilla, then you must love Anguillians. And if you love Anguillians, then you too must share our priority in keeping the people of this island safe. And that is the message we are sending. Beginning August 21st, interested persons are invited to apply for entry into Anguilla for dates up to October 31st. I'll repeat. Beginning August 21st, interested persons are invited to apply for entry for dates up to October 31st. Then, persons interested in coming to Anguilla from November 1st and beyond will be invited to apply for entry at the end of September. Managing this process, as you can appreciate, will come with a cost. Consequently, the cost for entry into Anguilla will be as follows. An individual staying for under 3 months will pay US $1,000. And an individual staying for under 3 months will pay US $1,500. This fee will only be payable upon approval, so it's not an application fee. These costs will cover 2 tests per person, surveillance, and the costs associated with the additional public health presence. For individuals wishing to stay for over 3 months and up to 12 months, the cost will be US $2,000. And for a family wishing to do the same, the cost will be US $3,000. These costs will cover the 2 tests per person, surveillance, additional public health presence, the cost of extended time, and a digital work permit. We are in challenging times. It requires us to think big and creatively about how we will address this time. Though it may seem trying, as it is, it can position us to be exposed to even greater opportunities. But we first have to take the first step, and this is that. And I can confidently say that our steps are guided by science and are rooted in epidemiological best practices. And now I will invite Mr. Foster Rogers, Permanent Secretary of Health, and Dr. Aisha Anjurin, Chief Medical Officer, to present on the health protocols.
Good morning, everyone. I want to thank you once again for the interest shown in the government and departments of government as we move forward in trying to protect the people of Anguilla and in trying to allow persons to enter on a strict basis. Anguilla has responded phenomenally, and Anguillians and residents of Anguilla have responded phenomenally to the actions taken by the government over the past 5 months as we implemented policies, regulations, and procedures geared at protecting the people of Anguilla from the pandemic. In this regard, we have been very successful. The fact that the government has repatriated 269 persons up to yesterday without any major incident, as of this morning, all results are negative, speaks to the strict protocols we have in place and the highly responsible nature of Anguillians all over the world who have conducted themselves in a very wise manner. The record will show that the Ministry of Health has always stated that the impact of the epidemic will be mostly economic because there have been tried and true ways to control epidemics. We have also stated that the country cannot stay closed forever, and that at some point in time, the government have to open as our people have to live and coexist with COVID. This does not mean that it will be done in a haphazard and irresponsible way. It will be driven by science that we have so closely clinged to over the past 8 months, when our team first suspected that the world would emerge in crisis back in December of last year. The Ministry of Health is beneficiary of pertinent and timely advice from our development partners, as well as colleagues and professional forums that we have on a daily basis, and chat groups, permanent secretaries in the region, and CMOs as well, as we get together on a daily basis and discuss protocols and practice. Persons who have lived through the shutdown may not have believed that that was the easy part of the pandemic. The truth is, as we've always suspected, opening is immensely and exponentially more difficult. As the Minister of Health has indicated, there are protocols we can easily recommend. There are protocols we can recommend which we can recommend with the provision of resources, and there are certain things we cannot recommend at this time. The Ministry is part of the strategy for reopening, as the Premier stated earlier. The science behind the 3 testing protocol is driven by research, both from the manufacturers and our partners at Public Health England, PAHO, WHO. And we still continue to conduct lengthy research on a daily basis and on a nightly basis as we look forward to opening further in a more controlled manner. I'm going to allow Aisha to go through a lot of some of the details, the Chief Medical Officer. The 3 testing protocols and the science behind it, we will discuss that in detail, and the difference between recommending 10 days quarantine as opposed to 14 days quarantine, depending on where you come from, and the science behind that. I'd like to state publicly, as I stated before, that as a Minister of Health, public health deals with populations and groups, not individuals as a doctor would deal with. Because as populations and groups, we have to protect the masses. We have to protect the interest of the population over the interest of the individual. This is a subspecialty of medicine. Epidemiology is a subspecialty of medicine. Just like people are trained in surgery, people are trained in ENT, people are trained in pediatrics. Epidemiology is a subspecialty of people trained using statistics and modeling and mathematics to protect the public by and large. And sometimes that means discriminating against certain groups. Because if you recall, in March we closed down the borders. That was necessary to discriminate against anybody outside of Angola so that we can have a period of calm, so that we can look at what is happening in the country and plan for reopening. It's constitutional and it's within our laws. In fact, if you look at our Constitution, it specifically states that certainly persons' liberty can be contained, can be curtailed in times when we have to protect people from infectious diseases and from spreading the virus. In fact, I refer you to Leviticus chapter 13. As far away as 3,500 years ago, when basic quarantine and restriction measures were put in place to protect the spread of infectious diseases. So there will not be everyone who's going to be pleased with the protocols and the procedures, but we have to look at the risk. We cannot take into account the individual interest of 14,000 people, because then we'll have 14,000 different protocols to deal with. So we looked at interests of the public at large to decide how we can protect the people of Angola. We continue the repatriation efforts and to open the economy, and we ask the people of Angola to bear with us and to deal with us in a way that we can open responsibly to the public. At this time, I ask the Chief Medical Officer to present.
Morning, everyone. Protocol having been established. Thank you for this opportunity to communicate with the public our intentions, and hopefully to allay some of the concerns. We are quite accountable to the public of what we have done and what we intend to do. I cannot state enough what has been said, that everything we have done has not been by preference or opinion. We have really tried our best to stick to the science and the international guidelines. That said, you would appreciate that there's nothing black and white, and everything has to have been contextualized by country and setting. This is what we continue to do with the sanctioning of our technical partners. So without repetition of what has been said before, I will attempt to draw your attention to the salient aspects of the protocol and answer some of the concerns that so far we have fielded and the things that are most prevalent in people's minds. So first of all, it is important to note that what we are doing is directly analogous. Direct analogies can be drawn to what we have been doing for the repatriation process. It is exactly the same thing in a number of aspects, right? So the concept of the testing, what we have learned over the months is that one-off testing that was done with countries that had their false starts, we realized that one single PCR test will not safeguard the population. Nothing is 100%, but we have moved away from that because we have realized or learned that sequential testing, and in this instance we mentioned from low prevalence countries of less than 0.2%, we're doing it at day 1 upon arrival, and at day 10, if you're from a higher prevalence, it goes back to the day 1, day 14. And we're asking also for our tests prior to arrival. That brings me to the first point that have been prevalent in people's minds, the question of, are we doing something different for locals than for tourists? The answer to that is absolutely not. What we have done is acted on new knowledge, which came to our attention in the past few weeks through work with our public health England counterparts, that allows us to conserve resources, because if you can safely move from a 10-day quarantine, from a 14-day quarantine to a 10-day quarantine, it speaks to conservation of resources. People get to go home quicker. And secondly, from the aspect of tourism, it's more beneficial to talk about restricted quarantine conditions for 10 days minus 14 days if you can do so safely. But this is predicated on that worrisome or annoying 0.2% prevalence, which I think we also got some pushback on that because people didn't understand. And that has to do with the science that says if you test at day 1 and day 10, you can capture up to 97% of cases if this person is coming from a low-risk area, right? So that is what that is based on. Further to that, it's very important to note that we will not have people just arriving on Anguilla's shores and just leave them up to their own vices. They will have to abide by the quarantine rules, and further to that, there's a strong field surveillance component that has always been in place that will be ratcheted up to serve the villas, and it will be done in collaboration with the villa managers and so on. There will be constant monitoring, which we have been doing as part of this repatriation efforts. Government facility and in the field has to do with temperature monitoring and monitoring for symptoms. Anybody that develops symptoms prior to the 10 or 14 days will be tested earlier. So that has been going on, and that will continue to go on. That speaks to the other aspect, I think, that has been a bit worrying to persons. We'll also be pressing for the 24-hour presence on the villa site as much as practicable, because then it speaks to persons' concerns that you have somebody present that can assure that the guests who will sign written agreements to comply with our conditions are in fact there as well. So that's built in. That is happening to some extent with the government quarantine, and in the community, we have the regular checks that we go around and check persons who are in home quarantine. Brings me to another point. You would have noticed in the recent weeks prior to this soft reopening, and as we get more further along in our repatriation efforts, there was also the concern about how come now first we were saying persons were eligible to be assessed for home quarantine if they are coming from low-risk areas, and now we're saying no, everybody who's being repatriated will go to government quarantine. The reason for that is a resource issue, because now when I talk about analogy, the villa guests would replace those who were running around in the field in the community. So we need to be strategic. We have to be careful about how we divide the labor. We do not have the cohort of persons, and that's another thing we're working on, to do all the field work. So in the first instance, we're putting those repatriated persons in government quarantine, and then the villa persons will have that. The villas will be the de facto government-approved facilities. So that there's a reason for that as well. I will share also another concern. We have been criticized about the cost of quarantine. I can tell you there's nothing like a controlled quarantine situation to allay fears if in the event you get a positive case. You do not have to worry about high-risk contacts in the community. We have seen this play out in the Caribbean. As a matter of fact, 2 months ago, I was in a conference with several countries, I won't call their names, who now had their first imported cases. They were doing more government quarantine, more of a control situation, and they're saying, you know what, this is expensive, this is worth it. We cannot go through what we went through the last time when people are at their homes and you have to run down contacts. Not good, it's labor intensive, and that is a way to mitigate against onward transmission of the virus, because we know at some point we're going to import cases. It's a numbers game. We've had a couple of hundred persons repatriated. Other countries are on the level of thousands. They're getting their cases, we'll get our case eventually. The only thing that might mitigate against this, there may be scope, the longer you take to do it, you are hoping that conditions are improving in the countries we're repatriating from. That could mitigate against that. But I would say we should prepare our minds for 1 or 2 imported cases, either through the guests or through the repatriated persons. The key at this point is to prevent onward transmission. We've done it before. That has been also the difference between Anguilla's 3 cases and a jurisdiction as Montserrat, 11 to 13. It has been the high-risk contacts. We were very fortunate that there were no high-risk contacts with our 3 cases. It's a very different scenario when you have high-risk contacts in the community. Right? So that's what we're trying to avert, and we hope persons will understand that as well. One of the important aspects of the protocol of arrival is the question of, besides the negative tests and whatnot, when persons are traversing from they leave where they're coming from, traversing or ports of entry, ferry or conveyances, will be mask implementation. This is another thing that has concerned persons. We are operating under what is called a source control strategy. It is guided by international guidance, World Health Organization, which has not failed us yet, which speaks to our transmission scenario, right? And it's quite appropriate. This is very different from what people are asking about, which is more a universal masking, where you basically get to the point where you have to put a mask on everybody. This is more appropriate for community transmission, especially in situations where you cannot physically distance. Very important. And as I spoke to contextualization, you would have noticed a gradual transition and ratcheting up and getting to that point, even in countries that have widespread community transmission. The first sort of low-hanging fruit or the primary setting is often public transportation. You have these highly urbanized settings, population density, trains, buses, universal masking there. And England has recently, I think they've increased that now to shop supermarkets and so on. But this is months in rolling it out. And there are very specific reasons for that, because there are lots of caveats around when and how you implement masks, right? In what settings and what is appropriate for your scenario and other considerations. So there is that. Similarly, many of the countries in Europe, the public transportation. That is where it's interesting when you talk about contextualization, because if we were to get there, God forbid, and we must make every effort not to, at least in Anguilla, we do not have that risk setting. And that is very unique. There are a few countries where and this is one area in which not having a public transportation system has been fantastic. So that's actually a good thing, right? Yes, so Australia is another interesting example. They have said, and they still continue to say, we recommend the use of masks in areas. They have 6 states where we have community transmission. Further to that, if you are keeping up with the news, Melbourne, a city in Victoria State, has a situation, and now they have made it mandatory. This is 9 months into the response. So to say what we are doing is not arbitrary, it's really guided by the science. Another consideration, or maybe what I can do in the interest of time, I like this graphic. This is from one, if you can see. This is from one of the meetings. We have many meetings, and I cannot stress enough and that's another important point. Nothing we are doing is being done in isolation. This is from one of the technical meetings we had with PAHO. This was meant to show the hierarchy of control for infection prevention and control in hospital settings. And they were using this model from the National Institute of Occupational Health and Safety. If you can see here, they have a hierarchy. The top looks at the most effective measures, and you go right down to the bottom to the least effective measures. And conceptually, the base of the pyramid, which is biggest, is showing which measures are most effective, and then all the way down here. I want to point to this and draw some analogies. I like this because it says 3 things. It speaks to one of the main concerns about WHO. Whatever we do is a whole package. It's not a one-off. It's not a masking and a putting people out there in the street to make you safe. It's several things that have to be happening at the same time. There's that. I want to also draw your attention to the fact that on the top of the hierarchy is elimination, risk substitution. The bottom of the pyramid, which occupies a smaller space in terms of efficacy, is use of PPE. Risk elimination is at the top. When we close the borders, you don't have to worry. If nobody's sick, they ain't coming here. We don't have it. That's good, right? And then at the same time, we locked down and we went home. And you said, okay, even if there's 1 or 2 persons coming from outside sick, we're preventing spread. That is risk elimination. Fast forward now to where we are forced to reopen and forced to repatriate and take visitors. Risk elimination speaks to quarantine/isolation and testing. Because what you do, if a person is ill, you separate him from your population and then you clear him. You put him under a prescribed period where he can no longer be infectious, even if he was sick, and even if after you've done 10 tests, you have a false negative by some miracle, you take him out of the population till you clear him. And we prove that he's good with the testing, right? So that's where our risk elimination has transitioned, right? Risk substitution speaks to why we are looking first and foremost to people coming from areas of lower risk. It's not an elimination, but you take a lower risk, for example, by saying, okay, US market is traditional, but Canada is doing much better. Let's try for the lower area. So that's risk substitution. And again, with the use of PPE, may be surprising to you that it's so low down, but there are caveats that are spoken to in the WHO guidance. You have the question of the supply was the first issue when we had our cases. And they're saying medical masks, let's keep them for the medical community. You have the question of quality. When WHO expanded this guidance to say non-medical masks for community transmission in certain instances, especially when you cannot physically distance, they could not speak to the quality. It's not a matter of just any face covering, right? They spoke to the layers, 3 layers, cotton masks. They talk about filtration, efficacy, being able to block out the virus, varying from 5 to 60%. This is not arbitrary. Our decisions have not been arbitrary. You talk about even environmental issues, a lot of waste being produced, you know, and in terms of even the breathability, lots of considerations and lots of iterations. In some countries, they say, okay, children under 6 exempt. I see some countries say, oh, children under 12 exempt. You understand me? So those are the kinds of considerations. And then there's a real issue around the proper use of masks because there's a contamination risk. If you really have disease in your community, there's a contamination risk. You tend to touch your face more with the mask on. We know the hand hygiene has to be an important part of that, which speaks to WHO's main point in just not looking at the mask as an isolated panacea that will protect us all, right? And there's also the element of fatigue and timing of interventions when they are justified. People will just get tired of you. There's a danger, so you have to be careful about when you implement these things. Funny enough, this morning, and very surprisingly, even though I don't know all of this, there was an article, there was a story on Wuhan, China. There's a pool party over this weekend, thousands of people, you know what I mean? And they were packed like sardines, and they said not a mask in sight. That speaks to the fatigue. It's a real thing. We have to be also careful about that. But then again, I just draw your attention to this to say what we have been doing has been guided by evidence, and we have had a response. There is no guarantee that we cannot make mistakes and false starts. And especially with the mask issue, I am imploring the public, wherever we end up, because if the situation changes and we have to put a mask on everybody, we'll have to do it. We must avoid that circumstance with every fiber of our being. We do not want to get to a situation with community transmission. We have countries that have mandated masks that today have community transmission. We got to be careful. We have to put our money where the efforts are, and then we can do whatever here appropriately. But this is where it is, and we cannot forget that. For that, we need everybody, right? We need the villa operators to market smartly. We need the tourism board to market smartly as best we can. We need the guests to cooperate. But very, very importantly, we also need the public, right, to cooperate with us. Because an adjunct to that is when the time comes, we have to reimpose and ratchet up our hygiene measures and our physical distancing. That will take all of us. But very importantly, in terms of the thinking and the sort of comments we get, when we have to fight misinformation and when we have to run behind stories and do damage control, it fatigues the hell out of your health response. Be careful. Give us the support to put our energies and put our capacity where it will be needed most. Right? Okay, thanks. I'm Dr. Goff.
Thank you to our health team. I'm now moving over to Ms. Gina Brooks, who is representing the Ministry of Tourism. They were the ones responsible for creating our tourism protocols, and they have been in touch with partners in the industry throughout the OECS and other persons leading the best practice to create this. So we are very confident in their work, and I'll hand over to Gina now.
Thank you, Paul Sec. Good morning to everyone. I adopt the protocol already established. The Ministry of Tourism, as the PALSEC mentioned, has been part of the driving force in relation to the development of the protocols for the various phases that the island will undergo as we begin to reopen to guests and other persons alike. So it is my task this morning to present in some detail the content of the soft opening protocols for the accommodation sector. We have put forward a disclaimer so that there is the understanding that the information contained in the protocol will be subject to periodic review by the Ministry of Health pursuant to the prevailing situation relative to COVID-19. It is anticipated that tourism service providers shall comply with the protocols therein, as well as all applicable laws and regulations for the tourism accommodation sector. Anguilla, along with the rest of the region, is now mandated to manage the health and safety of its people and at the same time resuscitate employment and the overall economy. This entails a gradual reopening of the tourism sector, which will require a heightened level of responsibility, requiring the ability to coexist with COVID as with other communicable diseases. The reopening of the tourism sector as a measure for the reviving of Anguilla's economic activity can be viewed as a great opportunity to hit the reset button on the island's tourism offerings. This means a chance to revamp much of how and what is offered in aesthetics and services to our visitors. To successfully achieve this, the reopening of the sector will take a phased approach. What differentiates Anguilla? Anguilla's protocol advantage is what we feel differentiates Anguilla. This will comprise of a rigorous application process, a 3 to 5 day PCR negative certification before travel, a PCR test on arrival, mandatory 10 to 14 day stay in place, and a PCR test at the end of the stay in place. As the PALSEC would have indicated earlier, a fee structure has been put in place to cover the costs that will be associated with the process, to include testing, security, and so on. So if you're coming up to 3 months, a stay for up to 3 months, the individual fee will be US $1,000. A family or group of up to 4 persons, US $1,500. There is an additional cost per person that will be announced shortly. And our business guests will, the fee for business guests to include owners of property here and those persons with investor interests of $1,000 US. If you're coming for 3 to 12 months, the individual fee is US $2,000. A family or group of up to 4 persons, $3,000, and the additional cost for that per person is to be announced. The business guest for the 3 to 12 month stay, US $2,000, and as indicated before, business guests refers to villa owners and persons with investor interests, and so on. To note is that the fees will only be applicable on approval of an application. About the protocols. The protocols have been set out in a document. The document will be disseminated to the various stakeholders and via various forms of media in due course. So our first section deals with the general administration, which just gives the guidelines for the operation. It licenses, which speak to what the villa owner is responsible for in terms of business licenses, licenses that are applicable to tourism operators, and as well as the health certifications. Training. We are going to highlight this section because this is fundamental to the outcomes. Implementation of a training and continuing education and training program for properties, a psychosocial support program between the Ministry of Health, Ministry of Social Development, and the accommodation. Simulation exercises will be conducted for the various scenarios based on the protocols. The sensitizing of employees to create awareness of signs and symptoms of COVID-19, and SOPs to be established to ensure that the staff are adequately equipped to carry out their duties whilst minimizing risk and exposure. There's also a section related to employees. Employees will be expected. We are saying that it will be mandatory for them to attend the training sessions. There's such training will be conducted this Thursday, and the Zoom link, it will be in conjunction with PAHO, and the Zoom link has already been shared with, if it's not done as yet, it's on the way with the various industry stakeholders so that they can have their staff in place to receive the training on Thursday morning. The training is an hour long, and we know that everybody may not be covered in Thursday's cohort, so there will be further attempts, further sessions in place as we move along. Staff will need to comply with basic protective measures and hygiene methods, maintain social distance, observe sneezing and coughing etiquette, and avoid high-risk socializing. We know that a lot of our guests become familiar over time, those who are repeats. So we are comfortable, we shake their hands, we hug them, we kiss them. You know, we have to now get accustomed to the new normal, which may be just an elbow thump or a shoe to shoe. Avoid contact with persons showing respiratory symptoms, example, coughing, sneezing, or runny nose, and practice good hand hygiene practices. For employees staying on property, employees must be in an isolated area and have very limited contact with the guests. We envision all staff pantries and kitchen areas to be fully stocked at all times. Employees, there will be instances where employees will have to commute, stay off property, and then come in. These persons will also be in isolated areas and have absolutely no contact with the guests. In terms of delivery of goods, scheduled delivery of items with the various suppliers and a designated area for drop-off and pick-up collection will have to be designated at the entrance of the property so that the goods can be placed and then someone can go and collect them once they're delivered so that there'll be no face-to-face contact. If there's a suspected or confirmed case, we expect that there will be immediate sanitization of the property as per the Ministry of Health's guidance. Medical staff along with MOH officials will get a list of contact for the guests to establish contact tracing. Our nurse and MOH officials will give instructions on self-isolation. The MOH officials will determine, along with property management, the level of risks and further action if necessary. Persons from the MOH, and MOH is the Ministry of Health, will ensure that all relevant care and actions to isolate suspected or confirmed cases on the property will be put in place, and if deemed necessary, in a government isolation facility. In terms of the isolation protocols, isolated guests will be confined to the particular area at all times and be compliant with the rules that are set forth. No staff will be in contact, and a table will be set up at the entrance to facilitate the transfer of food and other items. Disposable items should be used at all times. These items, once the meal is served, you partake, and then you'll return the items to the particular entrance area with the table, and then the attendant will come back and remove the items. So you get your notification that your items are there, you collect, there are no face-to-face, and you put your stuff back when you're finished for them to be discarded. No housekeeping will be provided. Cleaning supplies are to be provided for guests. Example, mop, broom, and other disinfectant and sanitizing solutions. All used linen be placed in a separate labeled and bag and laundered according to the property's laundry protocol based on the procedures put in place. The room should be as isolated as possible, no shared balconies, etc. In terms of frontline staff, all frontline personnel should be sufficiently informed about COVID-19 so that they can safely carry out their assigned tasks and prevent the possible spread within the establishment. They should be capable of informing guests how to inquire about the establishment's policy in terms of the preventative measures established or other services that guests may require, example, medical and pharmacy services, which are available in the area or at the establishment itself. They should also be able to advise guests with respiratory symptoms to stay in their rooms until they are seen by a doctor, which management should arrange immediately, as well as to provide basic hygiene recommendations if asked. Frontline staff, if possible, should not be vulnerable or high-risk persons. This includes persons with chronic diseases, such as heart conditions, chronic lung disease, immunocompromised, diabetes, and persons who are aged 60 years and older. Frontline personnel will be asked to observe all recommended preventative practices, such as social distancing, frequent hand hygiene, and respiratory etiquette. Reception desk staff should be familiar with the room occupancy policy for accompanying persons in the event of a suspected case of COVID. The latest definition of suspected case of COVID can be found on the World Health Organization's website. The reception desk should have immediately available the telephone numbers of the Ministry of Health and other health authorities. Official up-to-date information should be available about travel to and from countries or areas where COVID-19 is prevalent. Then there's a section on the kitchen, operations of the kitchen, restaurant and bars, dining areas, receiving goods, activities. We're going to elaborate a bit on the cleaning and housekeeping. Even in the absence of any cases of COVID, it is recommended that hygiene services be enhanced. Special consideration should be given to the application of cleaning and disinfection measures in common areas, the restrooms, halls, the corridors, elevators, and so on, as a general preventative measure as we learn to coexist with the COVID pandemic. Special attention should be given to objects that are frequently touched, such as handles, elevator buttons, handrails, switches, doorknobs, etc. Cleaning staff should be instructed accordingly. As part of the Tourism Accommodation Establishment Action Plan for COVID-19, there should be a special cleaning and disinfectation plan for situations in which there are sick guests or employees staying at the establishment within a few days after leaving the establishment. Written recommendations for enhanced cleaning and disinfection should describe the enhanced operating procedures for cleaning, managing solid waste, and for wearing personal protective equipment. Also, it is expected that the following will be implemented for rooms or specific areas which are exposed. Any surfaces that become soiled with respiratory secretions or other fluids from ill persons should be cleaned with a regular household disinfectant solution containing 0.1% sodium hypochlorite. That is equivalent to 1,000 parts per million. Surfaces will be rinsed with clean water after 10 minutes. And the surfaces, this should be done so after sufficient contact time with the solution. And in this instance, hypochlorite is chlorine, Clorox. Service staff may require additional training in preparation for handling, application, and storage of other products. When the use of Clorox or bleach is not suitable, it is recommended that an alcohol solution at a minimum of 70% alcohol is to be used. Textiles, linen, and clothes should be put in specially marked laundry bags and handled carefully to prevent raising dust with consequent potential for contamination. In general public areas where a case has passed through or has spent minimal time do not need to be specifically cleaned or disinfected, but in the order of overall disinfection and cleaning, we expect that the area will be sanitized. Our cleaning crews should be trained in all aspects of cleaning and disinfection and the use of PPE, their gloves and so on, and daily ventilation for all common areas. There's also a section which will cover swimming pools, desalination plants, and water storage, treatment systems, and waste management. And we've included the various contacts for the Ministry of Health, 1264-497-3930. Is there an email, Dr. Andrin? Okay. Okay. And the COVID-19 hotline, 1264-476-SOAP, and SOAP equates to 7627, so 1264-476-SOAP, which is 1264-476-7627, or 1264-584-HAND, which in numerical form is 1264-584-4263. The Department of Health Protection, 1264-497-2631, or email dhp@gov.ai. Princess Alexandra Hospital can be reached on 1264-497-2551, and we have also provided some useful links: www.gov.ai, which is the Government of Anguilla's website; ivisitAnguilla.com, which is the Anguilla Tourist Board's website; www.gov.ai/covid.php, and beatcovid19.ai. And there is one, www.ecdc.europa.eu/en, and www.who.int. We've put together what we think would be frequently asked questions. I know a big one would be, when does the application portal go live? And the answer to that is on Friday, 21st August 2020. Can anyone apply? Anyone can apply, but applicants from countries with less than a 0.2% COVID-19 prevalence rate will be given first preference. Applications from countries with a prevalence rate higher than 0.2% will be considered on a case-by-case basis. When to apply? If you plan to travel on or before 31st October 2020, you can apply beginning Friday, 21st August 2020. If you plan to travel after 31st October 2020, you can apply beginning the end of September 2020. Who decides the protocols? The protocols are being established by the Ministries of Tourism and Health. Can my property be listed as part of the program? First, your property would need to be registered as a villa and be pre-approved for opening by the Department of Health Protection. Will the protocols be available for public viewing? The protocols will be published via the Government of Anguilla's website, industry stakeholder groups' websites such as the Anguilla Tourist Board and the Anguilla Hotel and Tourism Association and the Anguilla Chamber of Commerce and Industry, and other media platforms. That brings me to the end of my presentation. Thank you for your attention. I now turn over to Mrs. Quincy Gums-Marie.
Thank you, Ms. Brooks, for your presentation. I do want to, before turning over to the ATB for their presentation, talk about the villas and how government view the villas. So once you apply and your villa is accepted, your villa is considered a government-approved isolation facility. We're no longer on government side looking at your villa as a villa. Technically, it's a place for isolation in a similar way that places where we have government quarantine occurring right now is a place for government quarantine. Your villa will be considered an isolation facility for your first 10 days. And once your guests are cleared, then you go back to villa status. It means then that the government would have access to your villa for surveillance purposes, also for the purpose of entry. We won't just barge in, of course, but if we need a public health presence there, you can't restrict public health presence from entering for whatever reason they would need to enter for the purpose of protection of Anguilla and Anguillians. And that also means that once you are a registered isolation facility, if you do have a guest who on the 10th day tests positive for coronavirus, COVID-19, then you cannot turn that guest away. So you can then say to the government, oh, I didn't think I would get a guest who would test positive, so I need to throw them out. You are an isolation facility, so you will have to house that guest until they are free to travel or they're cured of the coronavirus, or in the event of hospitalization, then they'll be moved to the hospital. So I just want to make that clear for persons. Because although we do not want to have a guest that comes in with COVID-19, we have to prepare for the possibility of that. Now I'll turn it over to the chairman of the ATB, Mr. Kenroy Herbert, and Ms. Chantel Richardson, the coordinator of international markets.
Okay, so good morning, everyone. I adopt the protocol already established. This morning, my colleague Chantel and I would present on the ATB's role and the reopening process and also the phase opening process. So first and foremost, the ATB role is to market the reopening process. We will also assist in training for the execution of the protocols. So as far as messaging is concerned, we have relied heavily on our advisors in the marketplace, and we continue to do so. It is especially important to constantly monitor the sentiments of our clients and the travel industry internationally. In the near term, we will target affluent travelers whom research In the near term, we will target affluent travelers whom research identifies as the least affected by the pandemic with the resources available to travel. We will showcase the villa sector product and private year options for high net worth individuals. We will also expand outreach in 2021, assuming that more consumers will be ready to venture forth again. We will keep the focus on our experiences and expand on the 5 pillars currently identified, which are romance, culinary, adventure, wellness events, and culture. We will utilize technology, and we will also run global campaigns. We will also focus on digital campaigns amplified by social media platforms. We will greatly expand our visual catalog and library, as today's consumers, they don't like to read. We prefer to look at video and content, etc. We will also work with stakeholders and offer refundable packages to 2021. For example, buy now, you travel later. Our target audiences are homeowners, repeat visitors, long-stay travelers, multi-generational travelers, and families. Working nomads, these are individuals who companies would have provided them with the resources to relocate temporarily and work from those places. And those working nomads, what we're going to focus on are in tech, finance, insurance, and the creative arts. Our target markets are low-risk source markets, example, Canada, Italy, Germany, France, and other Caribbean countries. So as our honorable parliamentaries, just making sure you're paying attention. As Quincy said earlier, our tagline is lose a crowd and find yourself. The reason why we have adopted this slogan is Anguilla is the perfect place to social distance. We are uniquely positioned to take advantage of this new normal. We're off the beaten path. We have uncrowded beaches. We have small boutique resorts and properties. And we have an expensive villa product that guests can come and, really isolate, but still enjoy all the perks of travel, pool, etc. So I'm going to turn over now to Chantel, who is going to continue our short presentation on our role, which is marketing.
Good morning, everyone. I adopt the protocol already established. At the Anguilla Tourist Board, our messaging will focus on Anguilla's reopening to commercial international travel as of August 21st on a case-by-case basis. We will also focus on Anguilla being declared COVID-free by the World Health Organization in June, and the fact that the island is taking a cautious approach to reopening. We will also focus our messaging on long-stay travelers, which will be given a preference. You come and find yourself by losing the crowd here in Anguilla. And also, Anguilla has been voted the #1 destination in the Caribbean, Bermuda, and the Bahamas 4 consecutive years in a row by Travel and Leisure. The marketing approach for the travel trade, media, and consumer outreach will include the following: digital advertising campaigns, the online promotions with key partners targeting both the trade and consumers. Our website will have a dedicated visitors landing page, the island health protocols, video, and FAQs, in addition to promoting the Experience Anguilla at Home platform. In the area of our social media, we will also focus on the creation of infographics, which will outline the steps before departure, during travel, and on island. This is geared to promoting the safety procedures and standards. We will also embark on co-op marketing programs with select trade partners throughout our various international markets. And in the area of public relations, we will continue with our press releases, destination featured articles, media highlights, and editorial coverage in both trade and consumer publications. In the trade relations component, we will also focus on virtual presentations and trainings, webinars, cross-promotional virtual marketing initiatives, and e-newsletters distribution. And I would just like to remind everyone that the portal will be live on the Anguilla Tourist Board website as of August the 21st, and we welcome persons to apply. Thank you.
So we have one more section. I hope that you're still listening. It's been a long presentation, but our aim for this presentation is to leave more answers than there are questions. And so we wanted to comprehensively cover all our bases. Our next step would be to actually to turn your attention to the screen to my left. I'm guessing that's your right. And we'll be now unveiling what our portal will look like. So this is now, you are a guest, you're interested in traveling to Anguilla, and where do you start? What do you see? How do you get here? This portal was created with, in collaboration with our partners at Thoughtful Digital Agency. The questionnaires covered departments such as immigration, customs, health requirements, and tourism requirements. And it will help us assess the risk of the person wishing to come to Anguilla and put us in a position to make a better decision. And when I say in this term, a better decision is a safer decision. So I'm now turning over to Ms. Tahira Banks of Thoughtful Digital Agency and inviting her to walk us through the process of what a visitor will see upon application. Ms. Banks.
Thank you, Mrs. Gums-Marie, and I'd like to adopt the protocol already established and thank everyone for being here today as a part of this process to present the visitor portal. As Mrs. Gums-Marie would have shared, my name is Tahira Banks, and I am one of the partners at Thoughtful Digital Agency. So our work on this project has been to develop the visitor portal, and one of the concepts coming immediately out of the discussion was that we did not just want individuals to come online and fill out an application. Persons had to understand what they would experience in Anguilla and get answers to some of the key questions that our team has answered here today. So this first part of the portal is going to be on the iVisitAnguilla.com landing page or website, a landing page on that website. And as you'll see here, it starts with a call to action or a message consistent with what was shared by tourism and the Parlsec, lose the crowd, find yourself. Coming down, we focus on, first of all, the fact that as of now, Anguilla is COVID-free, and outlining some of the procedures that have been put in place and what it is we have done as a destination to maintain this impeccable status. Right after this, persons have the opportunity to see who the program is for, who can qualify for this, and what the opportunities are for staying or in Anguilla. And so we categorize them as a breath of fresh air. If you're staying for under 3 months, you just need a quick break. Or bask in the sun if you're staying from 91 days to 12 months, right? And if you look at, let's say, bask in the sun, an individual, It will give details and the pricing. You'll notice that there are lots of calls to action, get started, and that's to really incentivize persons to apply. We'll get to the form in a minute. Life in Anguilla, we thought it was important to kind of showcase what it is you could experience or what it is one would experience when you live in Anguilla, as opposed to in, say, a major city in another part of the developed world. And so what you eat here, things to do here, and staying active. And as Mr. Herbert would have shared, the Anguilla Tourist Board has been very focused on using visuals to tell their story. And so we have inputted, or many of those visuals will be inserted here. In this next section, we will highlight the properties that have been certified as a part of the process previously shared. And as those become available, this list will continue to be updated. Their names, their contact information, and direct calls to action to book with them or get in touch with them. The same for taxi drivers or ground transportation. Applying and what to expect. It's really important, as Mrs. Gums-Marie has said in multiple meetings we've had, the experience starts from the time they visit this site. And so it's really important that persons are aware of what it is they can expect as a part of their application process to visit Anguilla. And so we began to outline that here. What you should know pre-arrival. What you should know when you're traveling to Anguilla. What you should know upon arrival to Anguilla, and staying in Anguilla. The beautiful part of a website is that it's dynamic, and so if the rules have to change, as the situation updates, we can make changes relatively quickly on here. And the final section of the site is really for persons and for anybody that's visiting Anguilla and really answering some of those key questions. If I'm going to travel to Anguilla to stay for 6 months or even 3 months, I'm going to want to ship my personal items. So details on what is a part of that process and pricing, being able to download a list of the shipping providers and the prices, information on homeschooling. And the Department of Education, through the Minister of Social Development, would have provided that information on telecommunications, and information on grocery shopping, courier services, banking, and again, as questions come in, we can always add to this list. So if someone says, well, I don't know, I want to know information on, I don't know, fishing, we can put that on here, right? Relatively easy. And then, of course, you could always hit the call to action to get started. And this will take you to the actual visitor application form, which is on the beatcovid19.ai site, www.beatcovid19.ai. It is not live now. It will be live on the 21st, but this is where it will be housed. And on here again, we will share the relevant information with individuals that are coming to apply, just in case they just happen to arrive here without having visited the initial site on iVisitAnguilla.com. And they'll go through, they'll enter their personal details. They'll select what categorizes them as a traveler. Are they a single visitor, a family, 1 to 4 individuals, a business guest, or a group? They will put in their last name, their first name, general personal details, contact information, their passport details, and their intended date to visit Anguilla. This is very important. They'll highlight if anyone is accompanying them on this trip, and if persons are accompanying them, they can add as many individuals using the format listed above. In terms of travel details, they can list what countries they've traveled from in the last 6 weeks. In the last meeting, I used the example of Afghanistan, but if we say Antigua, or I travel to Aruba, you can list, there's no limit as to how many locations you could list. But we know that that information is very important for health. And in addition, the purpose of your visit. Why are you visiting Anguilla? Visiting family, friends, vacation, business, in transit, other. And if so, specify. Where are you coming from, and what is your mode of transport? Private jet, private plane charter, shared plane charter, other. I'm not sure what other would be, but other. And then here you enter your employment details. your occupation, the name of your employer, and if you do intend to live or work remotely in Anguilla for more than 3 months, if you do select yes on this, you will be asked to certify that you make over a certain amount of money, which will be used as a justification for yourself to demonstrate to the team that is approving that you can support yourself while living in Anguilla. And a brief description of what business you will be engaged in on island. And we come here and we have the health assessment to select all of the symptoms that apply. I have none of these. In the past 14 days, have you been in contact with anyone that has COVID? Attended a festival? General questions. And then just this section here is to alert persons that within 3 to 5 days of traveling, they have to submit the negative PCR test, right? They don't have to submit it here because most of the time, no one is applying and then traveling the next day. But this is to let them know that before they can be approved to travel, they have to submit that. And I think at some point in this discussion, we spoke about insurance. So do you have a valid insurance policy which covers COVID-19? Enter your policy number, the expiration date, the insurance company, and contact information for the company. And then here you can list your accommodations while in Anguilla, your length of stay, the type of accommodation you'll be staying at. Sorry. The name of the property, right? And what I will say is that right now this is just you can enter anything, but when this launches and we have the certified properties, this will be from a drop-down list of pre-approved properties. So someone cannot just come in and say, I'm staying at Gina's house. They have to say, I'm staying at XYZ, Mr. Harklemville's villa, which has been approved, but they could only select that because it's in the list, right? And then the contact information of the property owner. The last section is the health consent. So you consent to all of the rules or information stated here by health. The promise that you will not work in Anguilla in an unauthorized, and the general agreement. And the final section here is that we give persons the opportunity to feel free to share any other details relevant to their application to visit Anguilla. You know, and again, that's why we have these discussions like the one yesterday. Someone might come and say, well, it's important for me to come to Anguilla because, I don't know, I've just been stuck in New York for so long, or when I say it's not New York, I've been stuck in Canada for so long, or I have a house here that I really need to check in on, but they should be able to list that information there so that the persons reviewing the application can see it. The date of the application and the applicant's signature. And we also understand, just based on the nature of the clientele that will be coming to Anguilla, in some instances, the villa operators is called? The villa operators may be completing the application for them. And so we've just specified how this is supposed to look. Jane Doe signing on behalf of John Doe. Yeah, and you submit and you're done. That's it. Okay, thank you guys.
So as you'll see, as you'll see based on the questionnaire and even the information provided on the I Visit Anguilla website, we are gearing our information to long-term stays. So you will find information for homeschooling options, for example, telecommunication options if you'd like to stay longer. How can you get an Anguilla phone? Who are the providers? And this information was provided by Flo in Digicel. And we hope to add very shortly banking information. There was a question about insurance. At this point, we do not have a government-issued insurance, but we are noticing that it is happening across the region. So we're not opposed to doing so, but we will have to begin the conversations to add that in, where there will be an option to purchase insurance from this website. And once it is feasible and it is something that we are all on board with, because we have to have the further information, the further discussions, you will then be able to purchase COVID insurance, COVID-related travel insurance from that page. And that will be an option that we are considering. We are noticing that it is popping up in Aruba and other countries who also, like us, would have a bit of a restrictive process to apply. So we're definitely not opposed to that. We will have, for sure, different further consultation if we do take that route with persons within the industry. And so now, I know you might have some questions. invited to ask any. Sorry, Mr. Hughes would want to make a statement first.
Not really a statement, but I just want to acknowledge the few hundred persons who are watching via social media and to note that their questions are being answered by both the Parliamentary Secretary and myself, and also the Anguilla Tourist Board. So those questions are being asked, and I'm sure after this is all done, you will still have more questions, and those questions will be answered. And as you can see, a lot of the information will also be uploaded online so that persons can find that information. And as we said yesterday, to those that were there yesterday, we will have some persons here in the Anguilla Tourist Board office who can field your questions and answer your questions, hospitality professionals who understand the nuances of the business. And, we won't be having you call and get a machine. So that is different. We do it different in Anguilla, and I believe that what we are doing here is different to any other country in the world. And I feel very proud to be amongst these persons who have put together such a tremendous opportunity, not only for the Anguillians, but those who want to visit Anguilla. So again, if you have any questions now or in the future, you can do so. Brenda?
Well, I was handed the mic, so I might as well start. For some months now, there's been talk of direct flights into Anguilla.
Yes.
As far as I can see, with this situation, direct flights would be ideal, that our visitors don't have to go through St. Martin. Have you accelerated those talks with JetBlue or anybody?
Well, I think that the Premier's whispering in my ear. He's my boss, and for fear of being fired, I won't answer that question with the answer. And I'll answer that question with the political answer. No, we have not advanced those discussions.
Okay. Do you have any plans to do so?
Brett, I will answer that question. No, we don't have that discussion right now, but we can speak about it afterwards.
My next quick question is, what is the current status of the border protection?
Border protection falls under the remit. Internal security, external defense falls under the remit of His Excellency the Governor. I'll pass the mic over to Mr. Foster Rogers, who can speak to that more eloquently than I can.
I am not His Excellency the Governor. But what I can say is, as of yesterday, the borders, the emergency rules and regulations were extended out until the 31st of October. It means that there still needs to be permission to go back and forth between Angola and St. Martin and other countries. EXCO looked at that last week, and we decided that it was necessary, and they decided it was necessary to have some control of the borders nonetheless. As you would recognize, for the last few months, there was heightened surveillance on land and in the air, but now it will be still surveillance, but not at that high level. You will not see planes on a daily basis, but there's still some surveillance, and we will still be controlling the borders.
And we also ask persons, if you see anything suspicious, to report it, and thankfully people have been very vigilant as it relates to that as well. Sorry.
To your first question about air support, right now we are very excited for what this means to our local airline industry. They have been utilized perhaps like never before, and they are really working overtime to ensure that air travel to Angola continues in a professional manner. So we are excited for them to have this opportunity to more or less have just the monopoly of air travel in Angola. And they're doing a tremendous job, and it is a tremendous task to service all the persons wishing to get in and out of Angola. And Trans-Angola and Air Angola services have been doing a really good job. What we have done, what they're actually interested in doing is looking into the possibility of creating more scheduled flights for connection hubs across the region to extend to Antigua, St. Kitts, St. Martin. So in the event of Puerto Rico, in the event of a closure of any of those ports, they are already able to act and find our guests wherever they are and work on bringing them here. So it's a great time for the industry. They're developing, And we're happy to use this time to promote our local companies.
So my first one is a suggestion. Maybe physical training on properties, because I know you mentioned there will be virtual training, but I know that different properties have different layouts and setups, and it would be good to let the staff have the opportunity to do their simulations on a property. So that would be my first one. The second one, I noticed on the website that there's transportation as an option for persons to schedule themselves. I believe that in order to maintain control, it would be best for that to be arranged through government instead of letting persons handle that themselves.
Transportation as in ground transportation?
Yes. Yeah. I
Also,
saw.
no, that's not going to be scheduled on your own.
Okay.
It will be a matter of, we already know that persons will be coming in because it's controlled.
Mhm.
We would know that persons are coming in, and that will already be something that's pre-approved and done prior to arrival.
Okay. Okay.
On the matter of in-house training,
Mhm.
every villa registering to be approved, will have to present an SOP, standard operating procedures, in line with what Ms. Brooks would have presented, and it would show how they would be able to meet all of the requirements we have. So first they will do, the first set of training will happen on Thursday, and then there will be an on-site inspection to see how feasible this will be. And if it is necessary, we then will bring in someone from, correct me if I'm wrong, Aisha, Dr. Andrian, from Health Authority, right, who will then do on-site training if it is necessary, if they require it. Yeah.
Also, please note that the government quarantine sites, there's also cleaning that happens there. So when those persons are already trained up at all of the government quarantine sites.
I just wanted to add the concern about ground transportation. There's actually a restriction until you clear quarantine from parental. So further to what Ms. Gomes has said.
I have 3 questions. Has a cost-benefit analysis being carried out by the government of Anguilla to determine if this is financially worthwhile compared to the risk?
So,
when we talk about risk, it's about managing risk. And at present, we have safely repatriated 269 persons, and persons will be repatriated today. And we expect to repatriate several hundred Anguillians over the next few weeks and months. So the same protocols that it relates to Anguillians returning home, those same protocols are in place for tourists coming to Anguilla. So COVID is COVID, and the protocols are the protocols. And I think Dr. Andrewen said, I think Dr. Andrewen said earlier that it's a fallacy to even think that someone will not enter our shows at some point who is positive. And when that person enters our shows that is positive, and when they have that initial test, and even if they test negative, that 14-day incubation period, at the end, we should be able to capture that person. If we capture that person at that point, then that person will already be in isolation. And so the risk to community spread is significantly minimalized, if not eradicated altogether.
Okay. We look at risk every day. That's our job. As I mentioned earlier, the subspecialties that we deal in epidemiology is statistics and modeling and mathematics. We do that on a daily basis. We look at everything and the risks. That is why we shut down, because at that point in time, the risk was just too great. We had to shut down. At that point in time, there were no tests available to identify COVID that was reliable. There was a heap of stuff on the market that we couldn't validate and trust. So we closed down based on the risk. We're opening based on the risk now, and let me give you some figures. We are one of the first countries going to use the 3 testing protocols. There are some countries around the world that only tested once and then released it to the public. And we can see most of the countries are now shutting down because on the first day of infection, there is no test currently, none, that can detect you positive with COVID virus on the first day of infection. So every test currently on the market will give you a false negative on the first day of infection because you can't identify the virus at that point in time. So we have reduced the risk. by modeling a three-test strategy. In fact, Iceland initially requested one test when you enter, and they spiked so quickly that they shut down and go back to the 10-day strategy. So our strategy is based on these 3 tests: one before you come to the 3 to 5 days, one upon entry, and one upon 10 days. Why did we choose the 10 days? We chose the 10 days because after 3 days, we can only pick up 25% positives. After 7 days, we can only pick up 67% positives. After 8 days, we can only pick up 93% positives. After 10 days, we can pick up 97% predictive value rate. That is the best any test can offer right now, but we can only do those when you come from a low prevalence country, right? So at the 10 days clearing, we have looked at the risk, and we are satisfied that if you come from a low prevalent country like Angola, we can more, and less than 2%, including Angola, we can more or less ascertain that after 10 days that person is negative. If you come from a high prevalence country, that's different. That is why they extend to 14 days for high prevalent country, because that is the incubation period of the virus. The longest time that anybody internationally has taken to develop symptoms is about 11 days. Internationally, there's nobody around the world that we have reported and through research have taken more than 11 days to show symptoms. So we are quite confident that the 14 days will capture persons who come from high prevalence, as we do now. Anybody come to Angola since June have been put in quarantine for 14 days. So yes, we have looked at the risk, we have looked at the cost-benefit analysis, and we are certain, even WHO has indicated to us, we cannot stay shut down. So the risk we are planning to take right now is informed by the research.
And again, from the public health perspective, there's an extremely important link to make between health and socioeconomic status and all those other things. Those are the determinants of health. There is a real danger that if you go into a deep recession, we have other social ills that will impact public health. You're going to get more domestic violence, you're going to get more crimes and so on. You will lose gains for decades, and it's going to be harder to come out of than this virus itself. After this virus is gone for 1 to 2 years, after 1 to 2 years, hopefully 6 months. Anyway, after this virus is gone, we have to worry about that impact. And we're seeing it, people talking recession, depression, the worst figures since. Those are important as well. So there is a direct link with health, the bigger picture, and looking at the longer term. And that is going to be difficult to come out of. So we are cognizant of that as well.
So when we mentioned earlier that, I remember 3 things earlier, stuff that we can do relatively easily, stuff that we can do with some resources, and some stuff we can't do. Right now, we are not prepared to recommend short-term stays, nor incubation, nor quarantine of less than 10 days. That's what we're trying to recommend the risk.
How will persons be made to compulsory isolate in the midst of an active hurricane season?
That's another benefit of Anguilla. Your infrastructure is impeccable. That's what served you well in Irma. So there are those things and there are those considerations. There's a quarantine checklist for homes that we will be expanding to the villa. That's going to be part of the assessment led by the environmental health unit and that team as well. So there are those considerations as well. The villas have to be fit for purpose for isolation, quarantine, and bearing that in mind. But that part, we wouldn't have to worry about in Anguilla. Some other setting, yes, but not here in Anguilla.
I just want to add this. If you go back to 1995, when Hurricane Lewis was coming to Anguilla, a lot of the hotels were open at that time, and people had the option to leave, and people took that option. Even as recent as Hurricane Irma in 2017, Zemi Beach Hotel was open, and they were able to safely get every one of their guests out before Hurricane Irma came. So the reality is even in the advent of a hurricane, we know if a hurricane is coming to our shores. We can project, and based on what we know, that a hurricane is coming to our shores, and we can safely get people out, because the United States, as you know, always send in lift to ensure that their citizens leave, and if persons want that option, they will be lift to ensure that they leave. But if persons want to have the hurricane experience, they can do so as well.
Final question. Why not develop and promote a national COVID security plan before any opening?
Sorry, repeat the question.
Why not develop and promote a national COVID security plan before any opening?
What does that mean?
Plans are rolling documents. We have been implementing a plan since March. You will not be able to see something that says that, because stuff changes every day. We do have a plan. We have been running it since March. In fact, as I mentioned earlier, we have been doing this in the ministry since December. When we went to Executive Council in January, there was no country in the region that was even thinking about COVID. But we went to the Exco because we realized what was happening internationally. The difference between today and the SARS of 2002 is the massive access to international travel, social media, and the aspects of just moving around quickly, and youth. The difference in the health, the outlook of people. So we knew there was a difference in this, and the possibility that it will get to the region rather quickly. That's why our plan was in place since all in the year. There are a lot of people who also, and I want to address the 0.2% as well. You're not going to go on any website. You're not going to go on anybody's website around the world and find which country is 0.2% and how it changes. We calculate these things on a monthly basis, on a weekly basis, almost a daily basis sometimes, because of the rapidly changing epidemic. It is done in a very scientific way. There's access to information we have that the general public will not have. That's just where Ministry of Health functions. We have access to places like Johns Hopkins. We have access to Public Health England, WHO, and so forth. So we have granular information. We can sometimes go down to county levels in the US and in the UK you can't have access to. So when we calculate this stuff, it's based on the mathematics and based on the modeling and based on the predictive value of tests that we use on a daily basis. And we sort of request, and I think based on our track record, we hope that the country can trust us when we give these figures out.
One of the things that you must understand too is that when someone applies, every single person that applies, we will know where they're coming from. And we can determine based on their location, their address, what the prevalence of COVID is in that particular area. So this is where we are. I mean, this information is not generally shared, but this is where we are.
Okay, I think my media colleague here made a point or raised a question, which one side has been beautifully answered from the health side. She was talking about risk and economic financial benefit. I've heard no mention made regarding the financial benefit side.
Well, I think Dr. Andrew spoke to that as it relates to the financial benefit, in that, in the issues that comes out of no jobs and no opportunities. I think she spoke to that. I don't know if somebody want to expound on it a little bit. Yeah.
Currently, Angola basically has no income. That's the answer directly. We have been closed down since March. We have had no paying tourists since March. Our economy is 70%, 80% based on tourism. So we've been shut down. So currently there is no economic activity in Angola. The money being spent in Angola right now is basically through people's savings and through other funding that had been on island prior to March. In addition to that, the UK government has given grants for recurrent expenditure for the health authority, $1.5 million US, which is assisting in keeping the health authority rolling, and about 100 million EC that we have to claim through our process to assist with government expenditure, and which has been lost to revenue. So anybody who's been around for Angola for the last 6 months knows the financial issue. There's no one in Angola now who should be in a position to say they do not know what the financial position is. This mechanism, as we know now, and WHO has always been clear on this, phenomenally clear. Firstly, they never recommended travel shutdown because they knew the economic impact, but because countries around the world handled it so poorly, and because other countries were doing something we could not accept the risk of other countries, so we had to shut down, right? WHO has now advised that if we do not open in a way that is responsible, it's going to impact people's schooling. It's possible that a whole generation of children can be negatively impacted education-wise. As it is right now, Angola is in a good position to open in a very responsible way. And Aisha also dealt with the other impacts of health and economics. If we can't get immunizations done, right now the immunization program in Angola is free. Right now we have a bill of $50,000 the ministry has to pay to PAHO to pay for immunization that we give free. If we can't pay for those, If we can't pay for hospitals for services, if we can't develop these things, the health system in Angola crashes. So what we have done is look at the risks of opening, look at a way that I can do it possibly in a safe way, and do it that way. Are we going to get cases? Definitely. There's no way to get around it. But if we do it in a way that we can control those cases, so there's no spread to the public, then there is no community transmission, then there is no issue. So our guidance basically is, yes, we have looked at the finances, we know the issue, but even greater than finances it is the economic impact. If it were not for these health projects and education projects that were funded by the 60 to 80 million pounds that they given 2 years ago, if it wasn't for the grants that were coming in through health services, if it wasn't for the $100 million for government services, Angola would be in a state right now that they're almost chaos with the robbing and the looting and other issues that could possibly take place. So yes, we've looked at it and we think the best thing right now for Angola is to open in a way that we can control it and get someone to come in.
Okay.
Yes, and I'm in a unique position of being Minister of Finance and Health, and so I understand the balance that is necessary. And so we have looked at the risk to the Anguillan population, and as the Permanent Secretary, the CMO, has pointed out, that risk is minimized with the protocols that we'll put in place. But again, I appreciate the concern, and certainly we do know that this time of the year, August, September, is not the time when a lot of tourists come to Anguilla, but using that we have this status, we are COVID-free, Anguilla is still a place where people want to be. We're trying to get the digital or working nomads, those who want to come here to work from here. I think that we have a unique opportunity now to get our economy kick-started and to get people back to work. And we're going to do it in a manner that safeguards their health, and also make sure that we don't get the social and economic scarring which is mentioned, because if we get to that point where we have this type of social demise, that will be another issue that we have to deal with. And certainly we are tasked by the people of Anguilla to ensure that their well-being is paramount. Thank you for that question, though.
Okay, thanks very much for the objective analysis that would have been presented by Mr. Rogers and yourself. But as a finance person, I'm still looking for some hardcore objective figures. Mr. Rogers started to go in that direction, but we will leave that as it is for now. I've heard during the presentations quite a lot of nice talk about international guidelines, the science and evidence. But God forbid, let's suppose things go the way none of us in here would want it to go. How equipped would be our health facilities on this island to take care of such a situation?
Mr. Hodge, you're talking about a worst case scenario.
Yeah, that's what I said.
It's a very good question. It certainly is something that's on our mind all the time. When we look at the figures, and then again on our risk analysis, most of the cases in COVID in the world right now will not need hospitalization. Most of them will never need hospitalization. In fact, when we did an initial analysis back in March, we recognized that out of every 100 persons who get positive, close to 90% of them, 90 of them will never need hospitalization. In fact, most of those 90, some of them may not even show symptoms. All right? And some of that 90 can stay at home as we manage our cases at home, our 2 cases will manage at home, and can convalesce and get better. Balance 10 may need some hospitalization, out of that 5 may need ventilation. When you look at the numbers in the U.S., they're seeing grant because the U.S. has 300 million people. So when you look at the proportion of 300 million people, it is different to the quantum, or it's different to the absolute figures in Angola. So when we did our analysis, we can hold up to 8 persons in our isolation unit at any one time, right? Which is more than we expect if we need hospitalization based on the numbers we intend to bring in. So we think we can handle it. It doesn't mean that We won't need resources in the future, but certainly currently at this point in time, we are prepared to hold between 8 and 10 persons in our isolation unit. We have about 7 or 8 ventilators, which is more than we think we need if persons were to come in. And we do have the staff that have been brought in from Cuba with the assistance of the British government. We have 3 nurses and 2 doctors who are very experienced in COVID, very experienced in epidemiology, very experienced in managing infectious diseases. That's why they're here. And some of the prerequisites to opening have been certainly indicated by WHO, and we have met those prerequisites to be able to open, be able to treat, be able to isolate, have a massive communication strategy, which is critical, and I think we are at a point now where we can do that. I want to mention here, I don't think we have thanked the British government enough for their assistance through this epidemic. They have been phenomenal. The resources we have gotten in terms of financial resources, the resources in terms of technical resources, the resource in terms of equipment has been absolutely phenomenal. Right now, we can test persons for COVID coming to Angola, and those test results can be given to you in 4 to 5 minutes. There are places in this world where you can't get results for weeks. So the first set of equipment we have right now, we can give you results in less than an hour. But not only that, the British assist us in getting us a redundant system of testing. There's another piece of equipment that we're setting up now, which should be ready to roll in about a week or 2 once we get the facility finished. That will be, and training, which is critical. They've also given us a gentleman from England who's to come in here for 6 months to work with our persons to assist with the training, because that machine is a little more technical than the closed platform we're using right now, because for that machine, you actually have to go into the virus and extract the gene, amplify it, and then test it, right? So it's a little more complicated, but that platform, we're able to test more. In fact, we have 8,000 tests for that platform right now, right? So I don't think we thank the British government enough, and I think I have thanked them certainly for the Ministry of Health level, but I think publicly, the response we've gotten and the support we've gotten from the British government has been phenomenal.
Okay, Mr. Rogers, I hope that you realize that some of my questioning is rhetorical, and there's a lot of devil's advocate in it. Okay.
No, that's fine. That's our job. We live around that every day.
A question to Mr. Hughes. We've been talking here, the Anguilla public is hearing what we're really saying. What is the role of our tourism reps in the US, in England, in Italy, around the world, in helping us get across the sort of information that we have been talking about here this morning?
Well, they have been doing a tremendous job in dissemination of information, and the information that we have and the information that we've shared, they have been sharing too. I would prefer, for the chairman of the tourist board to speak on this, because he can tell you straight up that this information is shared on a constant and evolving basis. And we have also shifted our marketing because of the various seasons. Just to speak a little bit about what the Permanent Secretary said about looking at all the time. Just a few months ago, Italy was one of the world's hotspots, and today Italy falls under that 0.02%. So it continues to evolve. We saw just in St. Martin recently, there were only 2 active cases. Now there are 202 active cases. So the reality is that this thing continue to evolve, and these are the things that we also monitor here in Anguilla.
I don't know if he left anything for me to say, but just to reiterate what Mr. Hughes has said and Mr. Hodge, the reps and I and us are in constant contact all the time. We share the information from the health team, from the ministry with these reps on a constant basis, and they disseminate information throughout all of the various countries that they represent. So, like I said before, I don't know if I could expand anything more on what Mr. Hughes have said, but we're in constant contact with them, and they have all information, and they share all information.
As a matter of fact, some of the information that has gone out, I've seen persons on social media, especially in some of those tourism platforms, saying, why is the information coming from the international reps and not from Anguilla? So now a lot of people, including tourists now, are watching it live and they are saying that it's also coming from the government of Angola. So we are all coordinating, all saying the same thing.
Okay, my final question, although I could question you all there on what I've heard this morning. My cousin Gina, right? She said a lot of nice stuff regarding the villas and so on, how we are going to monitor, how we are going to carry out certain things, or certain things we want to be carried out. Could you tell us, or tell the public, how you are going to actually monitor some of these things that you've been saying? How are we going to be sure about the protection of the Anguillan side of the story in the villas?
I think the mic is in front of the Parliamentary Secretary, so I'll allow her to answer that question. But we got a couple of.
So what we have done is, as I said earlier, and I'll allow Ms. Brooks to continue, but what we have done is that this process is rooted in risk mitigation research and, for your question, capacity. We will only have 200 persons on island at a time because of our capacity. This is a number that was determined by the health team as well as all of the surveillance teams included in this process. So everything that we are doing and have done will be guided by risk and capacity. So in order to do this, we will utilize sources like the special constables. We are getting additional nurses from St. Vincent and the Grenadines to shore up our public health capacity. And we are also doing more training for persons to know how to deal with the guests and to make it easier for our health team. And I would go back to something I mentioned earlier. The protocols require each villa to have a COVID management team. And those 3 persons are agents of the ministry, as in they have to report to the ministry, they have to be guided by the ministry's directions and directives, and the protocols that they give for their own interests. So we know that they will live up to the protocols that they create on their own. The protocols that they will submit to the ministry will have to be approved by the ministry, and it is based on the document that Ms. Brooks would have presented. So there are several layers of ensuring that persons follow along with the protocols that are established, and even if they do not, we have a lot of surveillance layers as well. Another thing that I should mention is that persons who will, the Quarantine Act currently will charge persons or have for 25,000? Up to 25,000 or 6 months imprisonment if they do not comply with the quarantine rules and regulations. 38,500 is actually the number.
Mrs. Gomes-Marie has put it very eloquently, so I don't know if there's much to add except to say no property will be part of the program unless they have been pre-approved by the Department of Health Protection, i.e. the Environmental Health Unit.
And also there are consequences to violations.
Yeah. Just like how a villa can be added onto the list, a villa can be taken off the list. So it is not in the interest of the villas to either skirt the law or to ensure that they go against the COVID rules and regulations. I mentioned earlier in my first presentation about the constitutionality of restriction and our laws, because I knew this would come up. I knew the issue of curtailing people's liberty would come up in a free democratic society, as most countries in the world are fighting with this right now. In fact, if you see the states, depending on whether you're a red state or a blue state, you look at the management of this pandemic differently. We don't have the privilege of having an expanse of millions of acres of land from the East Coast to the West Coast. We have 35 square miles and that's it. So our laws and regulations with regard to restricting movement we have to enforce very, very strongly. And we make sure put in the regulations the penalties for offense. Because at the end of the day, it can be money, as well as if you look at the Quarantine Act, we can also put people in a magistrate's prison. A magistrate's prison has been dedicated as a quarantine hospital under the Act because we know, based on international experience, there will be people who will be difficult to deal with, and there will be people who will have to deal with them in a different way. We hope it doesn't come to that. Our message is, just like when Angolans travel overseas, we respect people's cultures and norms and regulations and laws. We hope that when people come here, they do the same. So yes, we've thought about that as well, and we're hoping that we will manage it in that regard. The nurses, yes, EXCO has approved us to bringing 16 extra nurses, and we're now negotiating with the government of St. Vincent. As you know, they have a nursing school there. But we think we do have an opportunity for some persons in Angola as well, who may have been retired nurses, who have now back and are willing to work with us. So more than likely we'll not get all from overseas, but we probably can get some local as well. But those persons are for the surveillance, the monitoring, because of course when persons are on villas, we still have to send trained people to them to check temperatures, to give them a wellness check and those stuff before they can leave quarantine. So that they just don't come in and they go there and they don't see anybody else for the next 10 or 14 days. We have to go through our particular process, and we're preparing to do that.
One of the things I just want to add is that we are particularly interested in those persons who want to come to Angola and live and work for 6 months, a year. So that is something that we're going to be really pushing on, and hopefully all our partners, including you, the media, and the Angola Chamber of Commerce and Industry, will look at that as an opportunity for Angolans as well.
Just let me clear one thing, please. The number of 200 persons was brought up. That is critical during the quarantine period. That doesn't mean we're only going to have 200 people in Angola at a time. It means during that quarantine period, we have to manage them. So it's possible after we clear 200, and the 200 won't be at the same time. They will be rolling 200s, and certainly once they clear, we can have up to 10,000 people in Angola once they clear quarantine.
And the thing is that, you know, we manage it. We manage who's able to come. It isn't a situation where you just book a flight and come, you know. We manage the entire process. So it's going to be a lot of coordination between the villa operators and the government of Angola and the health team and so forth. Karen, I think Karen has a question. She's been ready.
I think I have 3 questions. I don't know if to ask 3 of them one time or if to go one by one. Okay.
This is the last.
Anybody have any additional questions? So can we just probably get one question each, because
Roll your questions 3 at the same time.
All right then. Well, I must congratulate Thoughtful Communications on the website. I like the tag. The tag, lose the crowd, find yourself, and it seemed like it's a very user-friendly website. My question is on the website is that once someone applies, after filling out the application, who approves the application for you, and how long is the process or the timeline given for the application? Because, you know, persons are booking for vacation, they have to monitor the time on which they would want. And my third question would have been, for the villa owners, how do you apply to get on the website? Do you have a fee to pay, or do you have to be a registered villa owner? Your villa has to be licensed at Inland Revenue, because we know some persons have people coming in that are not registered. So what's the process?
Okay, so that's some really good questions. I hope I remember all, but let me know if I don't. On the final question, we had a meeting with the accommodation sector yesterday that went very well, and all persons there would have given us their communication, their emails, and today they will be receiving a post-meeting communication, which will have all the information that we presented, including the protocols, as well as the application and how to apply and what are the steps. So this was already explained yesterday, but just for the purpose of the media and for your knowledge, they will apply to Ms. Kathleen Rogers of the Department of Environmental Health, And then there will be someone within 24 to 48 hours will go to the villas, look at the SOPs presented, and look at how realistic it is to enforce this, and just do a general check to ensure that everything that is expected by the Department of Health and required by the tourism protocols were met. The initial question about, sorry, say the first question again.
How long does it take?
The process, right. So first I should say that this is not going to be, we don't anticipate that it will be government ran, in that we understand that the tourism experience will be different this time around, in that it starts at the very moment you log on to this website. You are a potential visitor to Anguilla and we are treating you as such. So your communication will be handled by a representative of health and a few industry professionals who are accustomed of dealing with concierge work, and to ensure that your process and the communication of such will be handled with a similar speed and a similar care and a similar tone and mode of communication, so that we don't risk losing or destroying or disrupting our tourism products. And it's very important to us that in this time, in this peculiar time, that we maintain the Anguillian standard. So you will have a response between 24 to 48 hours, depending on the amount of persons applying at one time. And that is why we chose to go forward with a phased approach, where persons applying on the 21st will be coming in up to October 31st. And at the end of September, you can apply from November 1st and beyond. That is our festive season, to give us a chance to fine-tune the system and ensure that we are efficient for when the real bulk of traffic will come.
Hi, I was just curious, out of all of the villas right now, percentage-wise, how many you think are actually going to apply to be part of this program in the initial rollout?
We've had pretty major buy-in. It will be an individual decision based on whether you would want to meet the protocols and do all the work to create that, and that there will always be some who may decide that the risks are too high or the cost would be too high to administer, and that's fine. But in our meeting yesterday, the majority of the persons in the room are interested and they see the opportunity. Never before did we have a chance to focus exclusively on villas, and it also gives us a chance to, again, show up the Anguillian products. We have quite a few Anguillian-owned villas and Anguillian-managed villas, and those persons get the opportunity to show the real Anguillian style, and they are excited. We have been given a lot of information from the villa owners and managers. We've also been given a lot we've had a lot of consultation. They've offered their services to assist with the product. They have showed how willing they are to meet the requirements. So we anticipate a very big buy-in. As of yesterday alone, I think we had almost 70 persons attending that meeting that would have been advertised on the Thursday before. So I think that we're going to have a pretty good outturn. And as the demand increases, we'll see probably more buy-in.
This might be a good opportunity, as I think it was called the Charming Escapes, the smaller properties, because they never really got a chance to do the advertising. So this might be a good opportunity, which most of them are locally owned.
Yes.
It might be a good opportunity for them. I see some of the more upscale villas, yes, but some of those medium ones, not so sure whether they want to, at this time, do all the protocols. Maybe once they see how it actually rolls out and operates, they may come on board later on.
Well,
but it sounds like a very good initial rollout.
Quite a few of them were represented yesterday, and they are really the ones who, contrary to what you might have thought, they are the ones who are really excited about this project, because as I said earlier, never before have they been focused on as the key part of Anguilla's product. So they are excited of this opportunity, because now at least, even if someone doesn't come to Anguilla, when you look on the website, you're seeing their names as opposed to the bigger brands. And so they're getting the exposure that they deserve, and we hope that they get the opportunities to house persons, but they are interested.
But also, just to add to that, Airbnbs, and also there's an interest from the hotels as well. They are interested. I don't think that they are already there yet, but they are definitely interested. But Airbnbs can also form part of this as well. Last question.
Well, no, we got Pastor and Lloyd. That's it. Yeah.
Okay, one question here online is how many arrivals in a day permitted for control purposes?
Based on capacity, again, I'll pass this back on to Dr. Aisha Andrin. I think the number that we said can happen is 50 at a time, but I will pass it on to her to further explain.
That's actually based on the most persons we've had to release from quarantine and swab for release from quarantine, so we're using that. Everything will be tailored by the experience going forward. So we're saying we put that figure out, but that was based on the day we had to do the most swabbing and health checks. So that's why that number was used. Yes.
I want to applaud and highly recommend the Ministry of Health and the Tourism Department for this initiative. I think that it's time that we begin to reopen softly, as the word goes. But I have a concern, though. Although I'm not pessimistic, I want to ask this question. What, God forbid, again, but what if in the event there becomes an outbreak? What measures would be implemented to control that outbreak, and how? I realize that we, Anguilla, is the only island around the area who doesn't wear masks right now, and I'm grateful for that. We are thankful for that. But would there be a measure taken to wear masks in the future? We don't know what will happen, with this new initiative. But what are your takes on that?
Well, as we explained before, if we ever are unfortunate enough to transition to community transmission, that's going to be a problem, and those will be the things that we will have to implement. Our emphasis continues to be on preventing that eventuality through the management of the importation risk and onward transmission. Failing that, in a community transmission scenario, you're going to have to be talking about lockdowns, school closures, church closures. We don't want to go there again. So there are measures that you can take. And of course, the health system will be overburdened because if you get more numbers, you got the increased likelihood that persons will need hospital care. So you cannot emphasize enough that these measures, our approach has to be as it has been in terms of risk mitigation and managing that risk. So we should never entertain a scenario where we're getting into outbreak. So once you have the community transmission, things will change. Absolutely. And it's not just going to be mass. You're going to have to anticipate a lockdown. But we need to distinguish between an imported case, local transmission, community transmission, and widespread community transmission. We have to prepare our minds for that. The first case, we're not going to run back in our homes, right? The first imported case, we cannot run back in our homes. This is an existential threat and an existential crisis. That's why we're saying we need to manage that risk, and we will manage the risk because we do not have a choice. We will not give ourselves that option.
I think the greatest risk for an uncontrolled spread of the virus, sorry, Minister, is our uncontrolled borders. That is the greatest risk that we fear every day. Once we control the people entering Anguilla and we can put them in quarantine for the 10 or the 14 days, we think we can handle it. But I think people have to be responsible to know that we cannot manage a risk of persons coming back and forth on boats and so on. And I'm going to say it between St. Martin and Anguilla, if we do not know who's going back and forth. That is the risk. That is the main risk that I employ our Anguillans to be very careful, because if we have uncontrolled spread of this virus in Anguilla, we'll have to shut back down. There's no way.
Just to add to that is my biggest fear. My biggest fear is persons sneaking back and forth between Anguilla and St. Martin. Hopefully that is not occurring. But it comes down to 5 words. Prevention is better than cure. So as long as we embark on prevention, then we don't have to deal with the cure. I think we've been here for 2 hours and 20 minutes, and I would hope that I would allow the Parliament Secretary before the Premier closes off.
Thank you all for attending. As you would see, that this is a very comprehensive protocol creation, and it requires a lot of work, a lot of moving parts. It requires us keeping abreast of all of the details, all of the trends, anything new that's happening, we know first, and we have certain persons that don't sleep to ensure that this is a success. I can assure you this is not a haphazard process. It is not rushed. It is not going through, no one is entering into it without any consideration of the risk. It is about risk mitigation. It is about the research, and it's about monitoring our capacity. That is how we have been doing it. That is how we continue to do it. And we'll be guided by the technical experts in the Ministry of Health, the Ministry of Tourism, the ATB, to make this product a success. And thank you all for coming out here today. And we hope that you will too share the news that it is not haphazard. And there's a lot of work going in. And I hope that you're also equipped to answer questions as they come to you. Our intention of this press release was to leave more answers than questions. And we hope that we did just that. Thank you.
I too would like to thank everyone for coming out. I think that this was very informative and enlightening. You know what was stated earlier, that we are now reliant on the kindness of others to help us to get through this time. And I too want to share, my gratitude to the taxpayers of the United Kingdom, to the Foreign Commonwealth Office, DFID, the Minister, Baroness Sugg, to the Governor and the Governor's Office and staff for what they have done to make sure that we were able to get through it through where we are so far. The Ministry of Health, the Chief Medical Officer, Permanent Secretary and staff, Twyla especially, we're driving her crazy, but it's not intentional. She's doing a phenomenal job, Rochelle and the rest. I just want to say that, what we did when we came is there was $1,000 EC per month, and that was given to persons who qualified under Social Security. 800 persons who didn't. $800 for persons who didn't qualify under the Social Security scheme. And we extended that and raised it so that everyone would be able to get $1,000 EC dollars a month. And some people have had some trouble accessing that, and we are moving things along so that is more accessible. But we all know that $1,000 EC dollars a month is not enough to keep one person going, much less a family. And this is what is concerning to us. And also we have Anguillians who are abroad who have been trying to get home for a long time now, and because of the situation outside, we've had to suspend coming from certain places. We want to give them that opportunity to get home. And, it's not good for us to say let another country take the risk of our people being out there. Well, let's bring them home, and we can do it in a safe manner. And you had it outlined by Permanent Secretary Foster and Dr. Andrewen. We get that done. We start bringing persons in as visitors and long-term. They build up a relationship with us here in Anguilla. And, it's going to be a new experience. It's a new norm. But we feel that this is absolutely necessary. And we can do it in a manner that is safe, knowing that the health of our people is paramount. That's what our primary concern is. And as we balance improving and kickstarting the economy with taking care of our people, and then we know that Anguillians will follow the rules, and that is essential to this going well. And those visitors who come among us, they too will follow the rules. Otherwise, there are stiff penalties and certain restrictions that would go in place otherwise. And so, again, I want to say that this has been a well thought out program. It's been in the planning since before March, as you heard, and this is just now the rolling out of it. And we know that with God's help and with the people doing what is necessary, and the guidance from the experts here and abroad, that this will work for us. And we go knowing that we have a country that needs to flourish, and we will get there because Anguilla first, proud, strong, and free, and that's where we're headed. So I thank you again. I hope you guys can go out and have a good lunch now and get the word out. Thanks to everyone.
We miss you just as much as you miss Anguilla. We'll reminisce until then about how the cool winds blow and the sun always shows up. We'll reminisce until then. Songbirds sing sweet, sweet melodies that ring over and over again. We'll reminisce about the memories and all the friendships that keep you coming again and again and again. Daydreaming, grilled delights, and culinary delicacies. We'll reminisce until then. We know there are no white sand beaches in your city, so we'll reminisce until then. The world took a time out because we all need a time out. We'll reminisce until then. We're in this together as one with another until we see you again. We miss you just as much as you miss Anguilla. We'll reminisce until then about how the cool winds blow and the sun always shows up. We'll reminisce until then. Songbirds sing sweet, sweet melodies that ring over and over again. We'll reminisce about the memories and all the friendships that keep you coming again and again and again. Daydreaming, grilled delights, and culinary delicacies. We'll reminisce until then. We know there are no white sand beaches in your city, so we'll reminisce until then. The world took a time out because we all need a time out. We'll reminisce until then. We're in this together as one with another until we see you again. We miss you just as much as you miss Anguilla. We'll reminisce